Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto and I have Dr. Marco Vargas here. Welcome, Marco.
Thanks. Glad to be here.
We were talking. We recently met at a AAPPM meeting, and I've been sending some people over for you to help them with kind of being more efficient with their practice. We're going to get to that, but even before that, Marco, I know you have kind of a almost like an admirable practice that a lot of people would like. I know I'm the focus I have is like the $1 million mark, but like you've done the $1 million mark in 4 days a week. You didn't start there. You've been doing this a number of years. And I think what would really give value to our listeners is kind of tell them the trajectory, like kind of what things have helped you, what's made you more efficient, what's made you more profitable. Like how do you not waste time and see higher value patients?
Right. Sure. Well, so I started off like everybody else. I had surgical training. I knew podiatry, but I didn't know anything about business. And so I decided that I wanted to learn about the business. And there was a practice in particular that I had been watching for a few years. And I always wondered, like, how do they get so big and how do they make so much money? And it just kind of intrigued me. And so probably about 5, 6 years into my practice, I found that I was hitting like $800,000 a year in collections within like $3,000 or $4,000 for like 4 years in a row. And I thought that, it just seems so weird because, whether I marketed, whether I didn't, whether no matter what I tried, I always ended up in the same spot. And about that time, there was a mastermind group well, actually, there's a meeting that became a mastermind, and I joined them. And then I started talking to other doctors and getting to know people and learning things. And I discovered masterminding because I never really knew that that was even a thing. And so basically what I've done is over the years just picked up things from different doctors, and just kind of put it all together. And that's kind of how I ended up where I am. One of the hardest things for me though was to take the time to work on my practice instead of in my practice. Because intuitively, I thought, okay, well, if I take a half a day a week, that's a half a day I'm not seeing patients, I'm losing money. And, nothing could be further from the truth, because, that allows you to plan, it allows you to look at statistics, and allows you to be more thoughtful about what types of patients you're seeing, what kinds of procedures, those kinds of things. And then when you're seeing patients, it has a lot more impact.
Yeah.
So eventually I ended up doing just 4 days a week. I used to do 4.5, and then I got cut down to 4, and this kind of seems to be a sweet spot for me.
So the masterminding, I couldn't agree with you more. I think we tend to be very lonely. Even if you're in a group practice, you tend to be working isolated.
Right.
And there's different types of masterminds. Some are in person, some are virtual. I kind of like the in-person ones better because you make friends and you learn more usually during the lunch breaks than you do during the actual classes. Um,
That's true.
and let's go over like some of the low-hanging fruit. Like what are some of the ahas that you had during some of those masterminds that you wish someone had told you like 10 years earlier that really kind of, one thing would be taking a day off to work on the business. Okay, that's one thing. What are some of the other
Right.
things in terms of anything about procedures, DME, scheduling time, things like that?
Yeah, so there's a saying, it's plan your work and then work your plan. So you got to have a plan, right? So very right now I'm very protocol driven. My assistants know my protocols. My assistants will even suggest to me, "Hey, did you want to do the biopsy on that patient?" And I forget, "Oh yeah, that's right. Yeah, let's do the biopsy." So we're very protocol driven. Always having the most extensive care for the patient, which happens to coincide with the highest revenue for the patient.
Comprehensive care, right?
Correct. Right. So doing the most for the patient, not going overboard and doing things they don't need, but just doing the most you can for the patient. If a patient comes in with a corn, it's a 75-year-old lady, I'm not going to ignore the vascular status and just go for the corn. And maybe she has circulation issues. I don't know. So sometimes I'll do testing or things like that, because I know that if I was sitting in that chair, I'd want, if I'm going to the foot doctor, I want my foot to be looked at, not just the corn.
Mhm.
Because patients don't know what they don't know, right? So when you educate them, they're more than happy to have all these things done, and it happens to produce more revenue.
Yeah.
Um, but yeah, that's incorporating testing. Also, I've focused on vertical growth. So for a while I was expanding. I used to have 3 associates. I had 3 locations. And that was my idea of growth until I met a colleague at a mastermind, and they were like, well, why don't, think about dentists, right? Like they don't have a million offices. They have one office and they just do everything in that office. And every ancillary that you add to that office is pretty much all, to the bottom line, right? Because you don't have to pay another rent, another set of employees. So I focused on that, and that was a game changer for me. So everything I'm doing as much as I possibly can in my one office. So it's
Mark,
helped a lot.
a lot of people ask that question. They're like, okay, when am I ready to go to do a second office or get a second associate? And I always feel like, well, if you're not at the $1 million mark by yourself, like, or even beyond that, and you're like super cramped for space, it's not time to get a second. And
Right.
even if unless you and don't get a second office unless you want to go to a second office. A lot of people, I think they get, I don't want to use the word greedy, but they're like, hey, I want to open a second office. I'm just going to throw my associate there. They're going to work the thing. Well, I don't think it's going to work all that well.
Yeah, I mean, I know associates are great. I just haven't ever really been able to figure it out. I feel like bigger is bigger. It's not necessarily better, right?
Or not
And
more
so
profitable.
right, right. So that's why I focus on the one office and then do as much as I can. And then, I get that extra day, that Friday that I don't work, I feel like I more than make up for it during the week, right? So I'm
Yeah.
more efficient, so I can get that extra time off, and I don't have the hassle of the other office. Although the top line revenue isn't as, sexy, let's say, as when I had 3 offices. But the bottom line revenue, what I take home, is a lot better than when I had three
Yeah.
offices and other doctors and more staff. And I mean, it looks impressive, but really, you're not taking home as much as you think you are.
And so our overhead here is about, I don't know, it's about 60%. I don't know what yours is. Is yours about that? Is it less?
60, yeah, 60%, like
It's about,
58, 60.
yeah. So ours is about 60%. And what we found is as we get other doctors, the other doctors never produce as much as the more experienced doctors. Did you have that same problem?
100%. They don't, and I think there's a lot of reasons for that. But I've always felt like if you're going to hire an associate, if they do 50 or 60% of what you produce, that's probably a win, right? Because we've been doing this for a while, so we have experience. We're more motivated. It's our practice, and I think personality has a lot to do with it. Training has a lot to do with it with associates, and so it's complicated, and it's hit or miss. I've probably had 8 associates since I've been practicing, and I've hired them from like gut feeling. I've used the all the different tests. I've tried that. I hired a 2-year fellowship trained surgeon that did 1 surgery the first year. Um, so yeah, I don't know what the secret is. But that's when I decided that, maybe I'm not good with associates, and so I that's why I did it on my own. But I don't think an associate's ever going to produce what an owner is going to produce. And so if you have that in mind, and also if you're going to hire an associate, I think it's good to hire it when you're busy, not thinking that the associate is going to come in and build up your practice, because they're probably not going to do that.
I agree with that. Let's go over two diagnoses, kind of things that we see all the time, how you kind of make it profitable. Let's go over plantar fasciitis and then maybe like a nail fungus.
So plantar fasciitis, usually the first visit they'll get DME. So a lot of times they get a night splint. There's an edema sock or like a heel. I forget what it's called. It's not a heel lift, but it's like an air heel. It's called an air heel.
Uh-huh.
And then a lot of times those patients have posterior tibial tendonitis. If you
Mm-hmm.
palpate the posterior tibial tendon, so I'll give them an AFO for that. And then we start MLS
A
laser,
non-custom AFO?
non-custom, yeah.
Non-custom. Like a velocity brace?
It's a no, it's an L1971, so it has the rigid uprights.
Uh-huh.
And so I'll dispense that, and then we'll start MLS laser
Mm-hmm.
for the swelling and all that, and then I send him for MRI.
Mm-hmm.
So then, depending on how we're progressing and all that, somewhere down the line, they'll get shockwave, also custom orthotics, and then physical therapy.
Do you do in-office physical therapy or do you, so you have a PT? How much
Mhm.
can they produce, like compared to a doctor?
Uh,
Half, like 50, like 500,000 or something like that?
in physical therapy, so we gross probably around 350,000,
Mm-hmm.
but I pay the PT 90,000.
Okay, that's pretty good.
So yeah, So, I mean, actually profit wise, it's more profitable than a associate.
Because there's less
If
overhead.
you're
Yeah.
going for profitability, yeah. Because if an associate is producing 500,000 and I've always thought you get 10 or 15% margin on an associate.
Mm-hmm.
You got to pay them, percentage of collections plus you have their overhead
Mm-hmm.
and all that. So it doesn't leave a whole, cost of goods and all that. It doesn't leave a whole lot of meat on the bone for an associate.
Yeah. How about for nail fungus? Anything that works for you well?
Nail fungus is awesome. I love it. So I hardly do surgery anymore because
Okay.
it's just not as profitable. I don't enjoy it as much. And it just takes so much time. So I'm an attending here at the residency program here in Houston, and I have one of my former students. We have a deal where I send him all my surgeries and he sends me all his nail fungus. And he's like, are you serious? You want me to send you nail fungus? And I'm like, yeah, just send it to me. Don't worry about it. He's like, but you're getting the short end of the stick. And I go, that's fine. Don't worry about it. Well, it turns out that, my profitability on a nail fungus patient is about $1,500, which is way more than I would get on a surgery. So, when I see them, I'll do like a nail biopsy. If indicated, I'll do like a skin biopsy. Then
For
we
like
follow
tinea
up.
pedis, right? For tinea.
Right. Yeah,
Mm-hmm.
like a scrape. Then we follow up and we start the Lunula. We sell Tolsolin to go with that. We have soaks, the shoe sterilizer, all that, and then we follow those patients monthly until they're all better, which is usually about 9 to 12 months typically. And the laser that I use, the Lunula, is about 95% effective. I mean, it's amazing.
So
Um,
tell me about that, because I have a Lunula. I don't use it that much because I don't. Maybe I'm not using it the right way. So tell me how often you're doing it, your protocol, things like that.
so I do it. We do once a week for 4 weeks, and then
Mm-hmm.
once a month for 2 months.
Mm-hmm.
And then we wait a couple of months, see what happens. Sometimes, occasionally, rarely, we'll do an extra treatment if they need it. But they do Tolson every day, twice a day.
The
We do
topical Toslin, right?
Yeah, the topical. There's one for the skin. There's a spray for the shoe, and there's soaks. So the soaking they do twice a week, and then we follow them up, and that's we're seeing about 95%.
Really, without oral. You're not doing oral that much oral.
Oh, I rarely do oral. Maybe 2 or 3 times a year.
Okay. That's
Yeah, it
totally
works
the
pretty
that's
well.
the flip of me, but that's why we're talking. But yours is much
Yeah,
more profitable than my oral because
yeah,
terbinafine generic. So if you're
it
getting the
is.
results, and so even the real think glyphotic ones, you're seeing clearance.
Yeah, I'd be happy to share pictures. The other day we put like a little catalog together with like 5 patients that I thought like, wow. I mean, I don't know if this is going to work or
If,
not. It's amazing.
yeah, if you could send that, and then
Yeah,
I'll put it underneath this podcast if others are interested. And by the way, we're
yeah.
not paid by Lunula.
No,
We're just sharing about this stuff.
be nice if we were, but
That's awesome. Thank you. You may if I could, yeah, that would be a great change for me. So now we're gonna pivot here, Marco, a little bit. One thing I really admire about you is that you are kind of an entrepreneur as well, and you've been using virtual assistants in a way that I'm not. I use a virtual assistant as a scribe, but you use them to do all the back office because they're dependable, they do great work, and then you've started kind of another business around that. So tell me how, first of all, using it has helped your practice, and then kind of how you got into helping other people with it.
yeah. So after the pandemic, it was hard to hire people. We pay a lot of money. I mean, right now we pay $25 an hour to our medical assistants, which seems crazy to me, but that's kind of the rate around here. But even so, sometimes you walk in one day and you're like, "Where's Susie?" It's like they just disappear. They ghost you, right? So it was inconsistent, and so I decided that I was going to try to outsource as much as I could because I was already outsourcing billing. So I thought, okay, I'm going to outsource like my receptionist, outsource like people that call with billing questions, have somebody else answer those questions. Anything that I could do through computer or phone, um, I wanted to do that so that the employees that were on site are strictly for patient interaction. So the receptionist, the back office MA, so they don't have to worry about answering the phones, ordering supplies, nothing like that. Um, so I tried a couple other companies and they were cheap and they provided a body that had been a nurse or had been something in medicine, but they had no idea the way around a medical office. So by just coincidence, I found somebody in Medellin in Colombia, where I'm from. Um, and I decided, I'm going to train her and I'm going to see how that goes. So I trained her myself, and she's still with me. It's been 4 years. But I ended up adding another one and then a third one part-time. And so what it has done is I can leverage my staff and they can focus on patients in the office. Also, they do things like they'll go back and call the patients that, let's say I said I recommended a shockwave and the lady said I got to talk to my husband, or I'm not sure yet. Well, then the VA will call back a few days later and follow up. Hey, Dr. Vargas, wanted to make sure you spoke
How
to
do
your
they know
husband.
that? Do you put a little note in and send it to them, or do they just?
Because at the end of the day, there's a list of all of the treatments that I recommended. The ancillaries we focus on are MLS, orthotics, Lunula, and shockwave.
Mhm.
So all the patients go on that list, whether they accepted it or not. And then the
Okay.
VA, and it's on a Google Live document. So every day the VA goes back to check that live document to see who didn't accept it. And we already have a protocol in place. So if they didn't accept it, she'll call and offer $200 off a couple of days later. If the patient still says no, then she'll call back like a week later and say, you know what, Dr. Vargas just really wants you to have treatment, because you're in pain. And so he's just willing to do it for office visits.
Okay.
So we try to give access to treatment to all patients. So that's our protocol. So that's kind of locked in place. And I just, they'll get the patient back on the schedule. Patient will come in, get the treatment.
That's awesome.
So
And
we
then
don't
do
have
you
to
do you, do you
chase.
have to check off, or as they're checking out, who keeps this document? Do you fill it out, or is your some?
No, my front desk girl will put them on the list, on the
Okay.
Excel list. And then I kind of keep track sometimes and make sure to keep them honest, right? Like, hey, I didn't see Susie on the list, right? Or I didn't see this other patient, just to make sure. But I mean, 99% of the time, everybody goes on that
That's
list.
awesome.
And we do the same for appointments, right? So if patients don't show up, they reschedule, they cancel, whatever. We have a document called a patient tracker. And so that's also a live document. So all the patients that are scheduled or that come into the office go onto the tracker. And at the end of the day or end of the week, I can look at the tracker and it's green, yellow, or red. So if you're green, you have an appointment. If you're yellow, you got to go talk to your husband or you got to wait till after vacation. Red means they were discharged. So the idea is to get everybody that's yellow up to green to get them an appointment. And so that's the same thing. The VA calls, she checks the tracker every day, gets those patients back on the schedule so we don't lose anybody through the cracks. Like sometimes you'll see a patient, hey, why didn't you come back, 2 months ago? Oh, nobody ever called me. Even
Yeah.
though you're like, well, it's your foot. If you're the one with the pain, you should be calling us. But anyway, so we follow up with our patients so that we minimize, slippage.
Yeah, I want to mention everyone that's listening, like this is worth $1 million, just that right there. It's avoiding a leaky bucket.
Right.
Because the patients won't come back. You think they should come back, but they don't. They should do what you tell them, but they don't. And if you can get a virtual assistant, pay them $15 an hour, they're going to produce. What do they produce? You pay them 15, they must produce 150 or 200 or 300 per hour based on.
Yeah. Well, no, so we pay them 12.
Mhm.
And I've never done that calculation, but I mean it's definitely significant. I mean, so we used to have like 33% of our patients that we would lose. So like 33% no-show cancel. That's down to like 10.
Wow.
So, if it's 100 patients, let's say that's 15 patients extra that we're getting at $230 per patient
Mhm.
per week. You can
That's
kind of figure,
awesome.
yeah.
That's awesome. And so then you're using them. And then, so from what I understand is when someone wants one, they train with you for a little bit and then they go to the doctor's office.
Yeah, so I had a couple of friends ask me about the VAs, and it was kind of hard initially, like how do you incorporate into your practice and what can they really do and all that. And so I helped a couple guys, and then I decided, you know what, I like this. And so I started a company, and so every VA that we hire is a college graduate. They're bilingual, English and Spanish, and they train in my office. So they know my protocols for everything that I do. So they know how to answer the phone. We have a 10-point call script. They know that patient tracker. They know how to verify insurance, prior authorizations, call the pharmacy to, call in a prescription or a million things that we do here in the office. They learn everything that I do here so that let's say you hired a VA and you're like, man, I need her to start tomorrow. Well, she can start as long as you're okay with my protocols. Now, if you want to tweak the protocol, then that's fine, but you don't have to train this person. They all train on ModMed, which is what we have here in the office. So they know EHRs, they know, how to answer billing questions, with EOBs and stuff like that.
Yeah.
So, they're ready to go. And so I feel like that's kind of the edge that we have is everybody that we train has podiatry experience.
And this is another benefit. So you're not just getting a VA that's like doesn't know anything. You're getting someone, and you're getting Marcos's protocols kind of that you can use if you want or not. But it's
Right.
so much easier just to start with someone else's and then tweak them than it is to make your own, because he's already made the mistakes and figured out what works and what doesn't work.
Yeah, and then I always make myself available. So
Mhm.
like if a doc says, hey, look, I want to do this, I mean, $12 an hour versus $25 an hour is a huge savings, right? So you're saving money, you're saving time, you're taking stress off your staff. You're more productive, right? Because the VAs are in the background doing all this busy work and stuff to get patients back in and all that. But I've learned that because I've been doing it for 4 years, right? So I'm always available to doctors to kind of help them with the concept of using a VA because it seems like a great idea. But I know for me, I was like, well, but how does that person like? How do we make them part of our team, right? So that I can
Yeah.
call. And so I help with that, and I share my protocols and practice
Cool.
stuff.
If people are listening, I'm going to put it under the show notes here in the description, but just give the website where they can kind of learn more if they're interested.
It's virtuohealth.com, VERTUO health.com.
That's great. I think we gave a lot of value here to the listeners. Thank you for your time, Marco, and
I
I wish
appreciate
you
it.
all the best. Okay.
Likewise, I appreciate it. Thanks.